This episode of the Pain Education Corner is sponsored by the Camella Foundation. The Camella Foundation is committed to relieving pain naturally using osteopathic healing principles. Here at the Camella Foundation, we envision a world where people achieve their maximum potential by being empowered with knowledge and skills to heal themselves and others. This information is to be used for educational purposes only and not to be construed as medical advice. If you have any questions or concerns, please consult a licensed healthcare professional. Hello, it's Bill, the knee pain guru, and welcome to the Pain Education Podcast, sponsored by the Camella Foundation. We have a really special guest today. His name is Jarlo Ilano. He is one of the founding members of GMB Fitness, and I am going to let him introduce or share your knowledge and expertise.
Oh, thanks a lot, Bill. It's great to be on.
Yeah. So share, I know you're a physical therapist. I know you've been involved in martial arts, which has a very special place in my heart because I'm a martial artist as well. So would you share your journey, like where you were in your life to bring you to the point where you're talking with us today?
Yeah. So, I was kind of relatively athletic through, my childhood and teenage years, but mostly with martial arts. So I started, everyone says they go to community center karate and all that. And I did that. And I just kind of kept going. You know how you're 12 years old, your parents put you in it, and you're like, oh, we'll do it for a little bit. And, most of my friends fell off, but I kept with it. So I did that. And then I boxed when I was 13, wrestled in school. I got my black belt in Taekwondo when I was 17, that whole thing. And then Filipino martial arts is actually my main endeavor. My parents are from the Philippines, and I actually started when we were on there for vacation. And I always like telling the story because we were where my mom lives, which was in Bacolod, where her family was. And I did I did a private session, which was what they call a crash course. So it was 4 hours a day for a week. So I did 2 hours in the morning and 2 hours in the afternoon, and I loved it. It was the best thing in the world.
And how old was this?
I was 15.
Okay.
So, and that was brand new, like, working with a stick, working with a knife. And I didn't know too much of the language. I knew a little bit. And my teacher, Grandmaster Ferrer, he didn't know any English basically. So it's just body language, right? Trying to tell me how it goes, demonstrating, and I loved it. I loved it. So I kept up with that, and through, basically let's talk about martial arts the whole time, right? But when I moved to Hawaii back in 2002, I met with my primary teacher now, Burton Richardson, kind of famous in the Jeet Kune Do world, Kali. So I learned primarily martial arts from him these last 16 years, and also Brazilian Jiu-Jitsu with him. I'm a brown belt with that. So I just kind of kept going, I mean, it's not like I was going to be a fighter or anything like that, but I just really enjoyed it. And it sort of fit in well with what I liked even going through school and my studies. I was kind of pre-med for a while until I discovered physical therapy. And I went to clinics and, did volunteer work. I'm like, this is what I want to do, right? You're interacting with your patients and you're helping people like immediately. Right. One of the things my patients always says, man, you spend so much time with us versus doctors. So, unfortunately, with the healthcare system now, doctors really can't spend that much time with their patients, unless they're in like a really different kind of practice. They're lucky to get 15, 20 minutes with you.
Sure.
Right? So, I got my master's in physical therapy in 98. Right. So I've been doing this a while.
Okay.
Yeah, and then that sort of led me to when I met my friends who I founded GMB Fitness with through various, again, martial arts seminars, physical conditioning seminars, and we all had that sort of background. And that's where we are.
Nice. And
Yeah.
how long you graduated physical therapy 98?
Hmm.
And how long have you been doing the GMB Fitness, doing that
So
online?
we
What?
started that. We got together in 2009 and sort of officially launched 2010. We were very focused on sort of bringing gymnastic style training
Hmm.
to people. Our first product was with the rings, gymnastic rings. And
Hmm.
really at that point, this was 2010, there was maybe two other products out there, right?
Hmm.
I think there was a DVD from a gold medalist, but it was not really user friendly. It was sort of like, oh, here, do this, and they're like, oh wow, people cannot do that, unless
Yeah.
they have, years and years of training behind them. So we sort of developed that and worked through there, but then we realized, this was just sort of an entry point for people,
Hmm.
and it was really about working on telling people that there is a full body, whole body fitness out there that isn't necessarily, lifting heavy weights or running until you're exhausted. It's
Hmm.
what we term physical autonomy. It's like
Hmm.
really developing your body capabilities in a way that helps you versus having some sort of external goal that other people are telling you you need to do. Oh,
Hmm.
you need to get to a certain level of body fat, or you need to lift this much weight, or you need to be able to run, 3 miles in this amount of time to be
Hmm.
considered fit. And yes, that can be part of it, but it's you know how arbitrary that is for someone to just give you a standard and, well, you have to meet this or you're not fit at all. that's
Right.
that's that's not true at all.
Yeah. And I think it creates un, it's an unrealistic expectation for everybody across the board. And there's a big, it's almost like a gap between where the person starts out with and
Right.
they're like, oh, I want to exercise, and oh, but I can't do 50 push-ups right off the bat. How
Right.
do I get to that place?
Right.
Or
And it's
just,
disheartening, right? If you do this and you just like, oh, I just want to try and get somewhere, and then you don't even come close to some of these things that people are talking about, then why wouldn't you just quit?
sure.
Right? It's a normal, reasonable reaction to go, well, I can't do that at all, so I might as well do nothing. And then that is so bad, right?
Mm-hmm.
That's taking away almost like this birthright we have for really being comfortable in our bodies and exploring what we can do. And
Mm-hmm.
that's a shame.
Yeah.
That's what we're really fighting against, I think.
Yeah. I really like the philosophy. It's something that I've worked with myself
Hmm.
to figure out how to break down movements, or even working with clients. This is going to dovetail perfectly into our conversation
Yeah.
with that gap that exists, and how someone that's stuck in pain
Right.
doesn't know how to bridge that gap, doesn't know how to
Absolutely.
take where they're at. They're struggling with a new injury, an old injury, something like
Right.
that, and how they could begin to baby step out of that place to have more functional movement, more comfortable movement, more ease of movement. And I think that's what I really want to dig in with you today is your perspective, your philosophy, your understanding of how the body works, what causes pain, and how we
Right.
can empower people with an awareness of that path.
Right. Right. Well, I think, so, being a physical therapist and worked with thousands, literally thousands of patients over the years. I started at a time when, I hate to say it, but we were really pumping patients through, right?
Mm-hmm.
This was sort of, well, you've known what the healthcare system is like over the last 20, 25 years. And it's sort of been this up and down. And I remember seeing, and it's terrible to say, I remember seeing 20 to 30 patients a day. Now,
Mm-hmm.
earlier in this conversation, I talked about how we could spend more time. We did, but we also had, so many patients running through. I mean, I had 10, 12-hour days, and I had assistants and we were working through it. But one good thing is that I saw so many people and I learned from them, right?
Mm-hmm.
When you just see people and you learn from them. And, back in the late 90s and even early 2000s, the model was come in and I'm going to help fix you,
Mm-hmm.
right? I'm going to fix you. We're going to identify the problem. you're going to do this thing, and then you're gone, and good luck.
Mm-hmm.
Right.
Mm-hmm.
And after a bit of that, I was like, I really started to understand that that's not what how we could help people.
Mm-hmm.
It was much better for us to, as much as possible, help them understand what was going on in their bodies,
Mm-hmm.
versus, okay, the doctor is telling you your meniscus is torn, so we're going to do this, this, and this, and then you're good, you're going to be good.
Mm-hmm.
Right. You do 3 sets of this, and work on it, rather than helping them understand, like, how does your knee work in conjunction with your hip and your foot
Mm-hmm.
and your whole body, and understand, like, even just walking, you can get a lot out of just seeing how you walk, understanding those sensations, and really sort of being in tune with yourself.
Mm-hmm.
And that's really hard to kind of impart,
Mm-hmm.
but as you work with patients through it, and you kind of give them the benefit of the doubt that that's what they want and what they need, and
Mm-hmm.
really understanding what their pain is and understanding why it's happening, and that's been really fruitful
Mm-hmm.
for me. Yeah.
I hear you saying you're trying to increase your patient's awareness.
Oh yeah, absolutely.
Awareness of what's going on, because
Absolutely.
we don't know what we don't know. That's everybody on every
Exactly it.
level.
Right.
So how could you take somebody that wasn't aware of what they did to get them into pain, and now they're all, I'm in pain,
Right.
I just want to get out of pain? How could you increase that awareness in a way that moves them down a different path, that isn't going to recreate the pattern that they got them there to begin
Right.
with?
Right. So, well, sort of what's been going on with in pain science, especially the last dozen years or so, is
Mm-hmm.
really first giving patients the kind of education of what it is.
Mm-hmm.
And so, the main thing is understanding that pain is supposed to be a good thing, right? It's a protective response. Your body,
Mm-hmm.
your brain, your nervous system is telling you, hey, wait a minute, something's wrong, and you need to change something, or else you're gonna hurt yourself. It's you're gonna hurt yourself more, damage yourself more. So pain is a protective response to a
Mm-hmm.
threat,
Mm-hmm.
right? You step on a nail and you get hurt, and you're like, okay, then you got to pull that nail out,
That's not good.
right? Right. The trouble begins when that alarm system, that protective response, doesn't turn down like it's supposed to,
Mm-hmm.
right? And it just stays with you. This what everyone says, chronic pain, or like, oh, now my knee is bad. Now my back is bad. I've had it for years.
Mm-hmm.
And so that's the problem, that when the pain that is supposed to be good, supposed to be a good protective response, just stays on,
Mm-hmm.
right? It stays on. And so letting people understand that that's what's happening. And
Mm-hmm.
it's not necessarily because you're still injured,
Mm-hmm.
right? It doesn't, pain doesn't necessarily mean you got to heal more, or you're unhealed. That's not correct. What it
Mm-hmm.
is that your body is still experiencing this sensation of a threat happening.
Mm-hmm.
And what you had said earlier is really instructive, is because you have, a lot of times, you're still maintaining whatever pattern of disinformation. And that's what it is. It's a
Mm-hmm.
pattern where you're providing sensations to your nervous system that are still telling it, oh, something's still going on,
Mm-hmm.
right? And so, how do we give that to patients? Like, how do we let them understand that's what's going on? Is we have to provide better information,
Mm-hmm.
right? So the easiest thing is an example of, whatever, physical treatment people give you, whether it's heat or ice, or lasers or needling, all of that kind of stuff,
Sure.
right? All of that kind of stuff really just gives your nervous system different kinds of information,
Mm-hmm.
right? And it sort of breaks you out of that loop. A lot of people like to use the term reset, right? This
Mm-hmm.
is a reset. Whether you're taping somebody up, or whether you do like a mobilization or manipulation with your hands or anything like that,
Mm-hmm.
it's giving you this, giving your nervous system a chance to break free of that pattern,
Mm-hmm.
right? But the trouble is that's temporary,
Mm-hmm.
right? And we always used to say, well, this gives you a window now for providing good information. So really, you have to couple that with better movement.
Mm-hmm.
Does that make sense?
It,
So before you were moving, oh, sorry,
no,
uh,
go ahead. Go ahead.
before you were walking, right, and you're back and you feel it with every step. And
Mm-hmm.
even if it's as simple as, you know, taking some Advil,
Mm-hmm.
right? You know, everyone's like, oh, don't take drugs. Well, sometimes you got to, right? Sometimes
Sure.
it's just, you got to get that uh, flare up down. Now
Mm-hmm.
you're walking around and it's a little less sore,
Mm-hmm.
right? It can be as simple as that. The trouble is when people do these things, whether it's taking medicine or putting ice on, and then they don't do anything at all.
Mm-hmm.
They're like, oh, I gotta wait until it's fully gone before I do anything.
Right.
Well, you've kind of, I don't want to say wasted, but you didn't have a chance to work within that window and give your body, give your nervous system that good information,
Mm-hmm.
right? And so I'm being really vague here, but that's sort of what we're doing, right? When we tell people, well, here, try this movement, try this, and we're kind of coaxing them to get their overall physical capacity up back again.
Mm-hmm.
Yeah.
You're bringing a really good piece that is actually building on my understanding. One of the mindset shifts I was working with my clients on is taking pain as being bad
Right.
to having pain as being information.
Yeah,
You're
absolutely.
building on that for me. And it's like, we want to take that information and give the body even more information outside of the pain. Like you were saying,
Right.
the Advil or the manipulation or the whatever you're doing to give that window of opportunity to correct the pattern. And I think that's crucial, that if a client, patient, someone suffering in pain doesn't take the most of that window,
Right.
they're going to end up in the same place again.
Absolutely. And I'm
And,
I'm giving examples like, medicine and this treatment and that treatment just to show that there's many different ways to get out of pain, right?
mm-hmm,
Many different people can help you,
mm-hmm,
right? The trouble is if you think there's only one person. For me, I'm always like that. It's like, oh, there's only one person that can help you. Has to be this doctor, has
mm-hmm,
to be this massage therapist, has to be this physical therapist. And I think that's also limiting,
mm-hmm,
right? It's also limiting because say something happens and you can't see this person or
mm-hmm.
see this particular, you
Now
know,
what?
now what?
Yeah, now
Right.
what?
And so yeah, so it's I think it's super important and you're right, it's the mindset. First, it's the mindset that um what this pain really is. And it's supposed to be a protective, normal, natural mechanism. And to just say it's all bad, right, is the wrong kind of mindset, and that contributes to anxiety, contributes to all these things. And it's not just psychological, right? All of these, another kind of bad thing that's kind of come out with pain science is people kind of take it and go, well, that means it's all in your head, right? And you
Mm,
can think away this pain because it's just in your head. And that's
mm,
wrong. No, there's physiological reasons
sure.
why. Like even the whole thing of stress and anxiety, right? When people tell you, stress makes it can make the pain worse, and anxiety and all that, and people automatically think, well, that means it's just in my head and I can think through it. That's wrong. Stress and anxiety have physiological components, right? You
Mm-hmm,
have cortisol release, you have noradrenaline, all of these things creating physiological changes which feed back into everything else. So I think
mm-hmm,
that's also really important to talk to people about, when we're talking about pain, talking about it as a mechanism for that. It's very real. It has very real physiological underpinnings.
mm-hmm,
And even just saying that to people helps because they don't want someone to go, oh, here's your pain, but it's really just these nerves doing this thing,
mm-hmm,
right? They're, if they don't have that understanding that you and I have, they're going to think, well, this guy's just telling me it's all in my head,
mm-hmm.
right? And that's not what we're saying.
Yeah,
Well, not what you and I are saying.
sure. And
Absolutely.
there's a component where if you don't have that positive mindset,
Right.
yeah, like that's crucial. You have to
Right.
believe you can get out of pain in order to even
Absolutely.
move in that direction. But if you're coming at it for, well, I'm just going to think myself out of pain. Well, I think that's delusional. That is
it
not real.
absolutely is. So that right. This is a really nuanced thing. We're talking about mindset. We're talking about like, that positive mindset, that growth mindset. But we're also saying that is going to help you do the real change you need to do.
Mm-hmm.
Right? It's not that you have this mindset and your pain is going to go away. Right? No, that's not right. What this mindset will give you is it will give you that impetus and that understanding to do the work that you need to do to get yourself out of pain. And I
Right.
think that's a really good point, Bill.
Yep. That's awesome. Okay. I'm looking at my notes here, what I put down to make sure we're keeping on track.
Yeah.
One of the components here is I took a quote. It says, "No body part works in isolation."
Hmm.
I completely agree. Would love to hear your more
Yeah.
in-depth talking about that.
So this kind of goes back to what I said earlier, like kind of early on when you know we provide rehab and provide sort of therapy for people. We can go, oh, this is a knee coming in, right? Oh, look, I'll look at my schedule, right? And then you look at your schedule, like knee, back, neck, right?
Mm-hmm.
Wrist. And so it can be really, you can have blinders in just from that,
Mm-hmm.
right? So your person's coming in and they have knee. Of course, you should work on their knee.
Mm-hmm.
Of course, that's what they're coming in for.
Sure.
But you shouldn't be so blinkered that you think of this person as a knee,
Mm-hmm.
right? You think of this person as an ankle. And I think people that maybe are listening to this that have had that experience either as a patient or maybe they are a provider listening to this, they know what we're talking about. You
Mm-hmm.
sort of have it in your head, oh, there's this low back person or this disc person.
Mm-hmm.
And automatically that puts you in a bad place, right?
Mm-hmm.
When you're just thinking, uh, oh, there's a knee, so I have my three favorite knee exercises. Right?
Right.
You've
Yeah.
done this so long,
Sure.
and I have right, and the doctor's script tells me that there's a MCL, like a medial collateral ligament sprain, and all that stuff, and it's true,
Mm-hmm.
absolutely. But how is this person walking?
Mm-hmm.
Right? How is this person getting up and down? How are they spending their life, right? Are they sitting down because they're a desk worker,
Mm-hmm.
or are they in a job where they're continually having to get up and down off the floor, right? My favorite examples are plumbers, right? People that have to kind of go in these really enclosed spaces. We had a client who emailed in. This is one of my favorite stories, and this was a thing where he was responding to people that say, "Oh, you don't have to stretch. You can just do this and this." He's like, "I have to stretch. When I'm trying to change out this toilet and there's like literally a foot between me and the wall and
Mm-hmm.
all that, I have to be able to do this." And
Mm-hmm.
so when I do your program, right, I do your exercises and I stretch, I just can do my job better. I can feel better. I can do all these things. So that's
Mm-hmm.
what I think we meant when we say no body part works in isolation. We have to look
Sure.
at what you're doing throughout the day, who you are, what your needs are, and you can't just go, well, your ankle's like this, so I'm going to give you, here's a stair stretch, here's some ankle circle, here's some things like that. Yes, you do that, but
Mm-hmm.
it's sort of like you always have to zoom out as
Mm-hmm.
much as possible and as soon as possible to really understand where that client's coming from.
Mm-hmm. And I think it ties right into what we were just talking about a minute ago regarding if it's all in your head. It's not all
Right.
in your head, so it has to be in other parts of your body, and it also can't just be in the part of the body that hurts.
Right. Absolutely.
So having
Right.
that ability, it's almost even more than a three-dimensional, like multiple dimensions of looking at knee, hip, back, shoulder, neck,
Right.
mind. How is your mind playing a role? How is your emotions playing a role? How is it all kind of coming together into this package of person that's showing up before us that's asking for help?
Right. Exactly. And I think again we can go. right now I know we're speaking in general because we're trying to kind of help people understand it,
Mm-hmm.
and to get really specific is hard. But I think one good example, and again to bring it back to real, you know, I think people can like when we can say, okay, here is the biological reasoning for it, right? The
Mm-hmm.
physiological reasoning for it. And before, or not before, but even right now, sometimes that got too granular. Like for example, let's go back to the knee,
Mm-hmm.
right? And since we're, you know, you're the knee guru, and let's talk about the meniscus because it's
Mm-hmm.
such a common thing, right? People
Yes.
say they have meniscus tear, degenerative things, and so but the meniscus, as you know, is for cushioning,
Mm-hmm.
right? Sort of ball bearing, and only the outer third, right, has enough blood supply, right, to heal
Mm-hmm.
if it's torn.
Right.
So when doctors tell patients that, and they say, well, it's torn all the way through, but only this little bit can heal, so probably it's going to be torn forever,
Sure.
right? You've heard doctors tell that, and you've
Of
heard
course.
patients say, right?
Yes.
How does that make you feel,
Hopeless. Like,
right?
well, I might as
How
well
does
give
that make
up.
you feel when you say, oh, and it's terrible, but
Mm-hmm.
you have to go on, and but they don't get the next part of
Mm-hmm.
what of the information, which is um, that it doesn't have to physically heal for you to get out of pain. Like that
Right.
tissue doesn't have to magically, right, get to 100%,
Mm-hmm.
because there's lots and lots of people with torn meniscuses all the way through, or
Mm-hmm.
menisci.
Um, you got me. You're the physical therapist.
And I always get tripped up on that. But there's lots of people with that are living great lives, no pain. You've seen it. I know you've seen
Yes.
it,
Yes.
being able to do everything they can. So why is that? Is
Mm-hmm.
because everything around the knee, the hip,
Mm-hmm.
the way you move,
Mm-hmm.
you've changed that pattern, changed the information
Mm-hmm.
so that your body goes, well, that's not really a problem. It
Mm-hmm.
just exists. And you can put that throughout the body.
Mm-hmm.
Disc changes, arthritis, right? In your site, you talk about when people say bone on bone.
Mm-hmm.
And that is such a bad statement to make, too. How does that make you feel?
Yeah.
Right? And so giving our patients, clients, an understanding of, yeah, that's true. This X-ray does say that, the MRI does say that, and we have to know that so we can work around it and do all these things. But it's not like a death sentence. It doesn't mean you're done,
Mm-hmm.
right? And go on.
One of the and yeah, gosh, it had to have been. It may have been longer. I'm losing track of time here sometimes. Maybe 4, 5, 6 years ago, there was a study that was done with meniscus tears.
Mhm.
They did a placebo on half of the group
Yes, right,
with meniscus tears. They were like,
right,
okay, you half of the group is going to actually have meniscus surgery. The
right,
other half of the group is going to just have incisions put in their knee, and they're not going to do anything. And then
right.
they're going to do the physical therapy afterwards. Let's see how the group turns out. And there was like, I believe it was no difference
Right. There
in
was not.
terms of
Right.
how the knee was in terms of in pain or out of pain.
Right.
Yeah, that you couldn't tell. So
Right. So important for people to see that. And that's not saying that, oh, that means never get knee surgery,
right.
because there's a difference, right? So first, yes, absolutely. And that's replicated in the shoulder. It's been replicated in the shoulder for rotator cuff tears.
Oh gosh.
They've even done it with and this got me because I only just recently learned this like a few months ago. Even lumbar fractures. So there's compression fractures
Really?
in well, let's go back. So the population in, as you get older,
Uh-huh.
right, there are osteoporosis, all these type of things. Your bone density decreases,
Mm-hmm.
especially in women, just sort of the way it goes. And compression fractures at the thoracic spine. So, we
Okay.
have our vertebrae. Compression fractures are, compression is when right? We have a load on our back, right?
Mm-hmm.
Maybe you fell on your butt,
Mm-hmm.
right? And then you just kind of get crunched,
Mm-hmm.
right? So compression fractures within the body of the vertebra, you could, yeah, very painful, absolutely,
Mm-hmm.
because this can go out. There's nerves, right? The traditional intervention is to inject uh, into the bone. Uh, if I think it's a solution, I'm sorry, I don't know it specifically,
Mm-hmm.
but it heals the fracture. It kind of
Mm-hmm.
fills it up, right?
Okay.
They actually did studies on people that had that procedure done
Uh-huh.
versus not having it done,
Uh-huh.
and it's the same thing that you said with the meniscus. The
Yeah.
pain was the same.
Mm-hmm.
It was decreased across the board. And so I think it's important for people to understand that you don't have to have full healing,
Mm-hmm.
right? uh, but okay, so let's do that with saying, oh, don't ever get surgery at all,
Mm-hmm.
right? That's not true either. I mean, we
Mm-hmm.
talk about nuance, in particular with the knee. The ACL is a good example,
Mm-hmm.
right? ACL, there are people with no ACLs, full tears, and they're doing good. You know, they're walking around, they don't have pain. I'm sure
Mm-hmm.
you've seen it, you've done it, but also too, it's still unstable, right?
Sure.
It's still unstable for activities where you really need it. For
Mm-hmm.
example, if you are going to be playing soccer
Mm-hmm.
at a higher level, or you're going to be skiing,
Mm-hmm.
right? You probably should get that
Yeah.
ACL
Yeah.
surgery because that's what it is. But if you know you're not really going to do that, right? If you just know you just want to walk around and do, your normal activities, maybe you don't need it,
Mm-hmm.
right? And I think that's for important to tell people. And this is hard because I think it's easier to understand. Plus, people want to have very black and white answers,
Mm-hmm.
right? Oh, no surgery at all,
Yeah.
right? Or yeah, you should get surgery every time. When really it's very dependent on who you are, what your needs are, what your goals are, and what you can handle, right?
Yeah.
And that's a hard sell, right? It's a hard sell to sell nuance like that.
It, I mean, there's a list of NFL football players
Right, right,
that don't have ACLs that have played their career
right.
without an ACL. So it's possible.
It's possible.
However, what I really appreciate what you're talking about today is the quality of nuance in the conversation that needs to be had that lines up with the outcome that you want.
Right. And so with those football players, that's a great example because that's their job.
Mm-hmm.
And they are, so say they decided not to have surgery. That means they are working their asses off to be as strong and stable and
Mm-hmm.
aware and have that motor control, have that flexibility so that they can do it. Now you transfer that on to someone that has their own job, their
Mm-hmm.
own family responsibilities, their own time, will they be able to do all the things they need to do that and play, and then go ski every, season for a couple times, right? Or go play their rec soccer. Maybe,
Yeah,
maybe not.
maybe not.
Yeah, you have to be able to acknowledge that for yourself.
Sure,
But that's a
sure.
great example. Yeah, I know. I had even friends that a friend of mine. She played volleyball pretty competitively, and she had failed ACL, like I think 3 of them. Some people it just doesn't take.
Mm-hmm.
And then finally, she's just like, no, I'm done. I don't want to keep going and getting. And then she ended up being fine because she put in the work. She did
Mm.
everything she needed to do. But yeah, that was really instructive to me. I was like, oh man, how are you doing this?
Yeah,
Right?
that
But she did
was,
it.
yeah, that wasn't my experience.
Oh, really?
That's how I got into all this. I
Uh,
dislocated my left knee 4 times, and I believe I partially tore it 3 times. And as my body would compensate for it, I would tear a different piece
yeah.
at a different
Right.
end because the body was shifting to adjust for that.
Yeah.
And finally, I
Absolutely.
remember on the last throw to first base, scooping up the grounder and throw to first base, it just went pop. And I was on the ground, face planted. And it was like, I
Oh
didn't know
wow.
how I got there. And then it was
Right.
like, oh, I better go to the doctor. And sure enough, it was only 30% attached on one end.
Right.
So it's just amazing. Like, it amazed me how my body had shifted for that. So I get it. And I wasn't at a place in my life where I was ready to make that commitment of figuring it out. I was like, okay, do the surgery.
Right.
And of course, my mindset at that time was, I get the surgery, I'll be right back out on the judo mat.
Right. Exactly.
I'll be good. So I had this whole mechanical idea of how the body worked. And then all these other things, this nuanced conversation on the other side of the surgery, the physical therapy, I was going, well, this didn't turn out like Bill had thought.
Yeah, that's the hard part.
So it was a long slog from there to figure out, that's 23 years now that I'm figuring this stuff out.
Oh, that's great.
Right. So, yeah,
I think that it kind of lends itself to where are we coming from, right? I think we have to have some base. So when we have your example, right, you were actually, you were physically capable, you were doing things, you were working on something that only had 30% right attachment, but you were somehow still doing it, right? Right. But at the same time, you're kind of in that, sometimes that example I give of like, okay, you're doing it, and right, we're saying, oh, it's all in your head, you can do it. Then look at Bill, he was able to do this on 30%, but your body finally said, that's enough.
Yeah.
Right. It was turning up that alarm system higher and higher. It's like, what do I need to do to tell you to stop burning yourself into the ground?
Yes.
And so you collapse.
Yeah.
Right. And I think everyone listening to this has had some of that example, like, oh, my back, suddenly I just collapsed because my back was, is out, right, or whatever, or my knee is out. I think that's just an example of your body turning up that dial as high as it can, because it's like, what the hell are you doing? Listen to me, right? Listen to me. And I think that happens to a lot of people that are like, okay, I can do this, or I'm trying to ignore it. Right? The body it's gonna catch up with you, and it's not because of damage. It's because your your brain is going, well, hold up now. Or what are you doing to yourself? It's trying to protect you, is what it is.
Thanks for tuning in to today's episode of the Pain Education Corner. If you have a special talent or skill to relieve pain and you'd like to become a guest on our show, visit us at thecamellafoundation.org/interview. Help us spread the word on eliminating pain and suffering in the world. That's thecamellafoundation.org/interview. Did you have, getting into all of this, did you have any of that, the injury that kind of guided you?
Yeah, so that's that's a good question. Back when I was in PT school, a lot of my classmates had that. They got into therapy because they, as kids or teenagers, they had, surgeries or ACL tears and all. I didn't really have that. Right. I just sort of liked it and went into it. But of course, later on, like let's say in my 20s and 30s, I started having, doing more and more. I've had back pain for a long time, low back, mid back. And so that's sort of kind of instructive to me too, because once you're really in it, all of this theoretical stuff, right? It's just like, okay, now you're dealing with it yourself.
Yeah.
And, I think understanding that has helped me. Right. And it's really hard to do it yourself. So I always have, I have my friends help me. I have all these things, but really the mindset. And for example, recently, and this is, so I've been, I work out a bunch, but, I'm 46 now, almost 47. And age does matter.
It does.
It matters not because you can't do things anymore, but it matters because you can't do as much for as long and as intensely without taking a break. Like even, I was just thinking about this, even say 10 years ago, I was able to do so much more, right, within a shortened amount of time. I like to say that I can still do the same things, but it's sort of drawn out a bit. right? I'm sure you have that same
I do.
experience.
Yes.
Right. So a couple months ago, I was starting a new lifting program. I was
Mm-hmm.
like, oh, I'm going to get back into lifting weights because, we're in quarantine. I wasn't teaching my classes, right? I
Mm-hmm.
was like, I'm going to do that. And it was great. I was doing good.
Mm-hmm.
And I was starting something new. It was deadlift squats, and I felt great. I felt
Mm-hmm.
awesome. Right. But then that weekend, I actually had to teach one of my women's self defense seminars for my friends. It was
Mm-hmm.
great. We were outside, Mad Max and everything, but it was cold.
Mm-hmm.
And within like an hour of teaching, and I use myself as the dummy. So they're hitting me and doing all these things. Right. And it's great.
Right. Yeah.
And then all of a sudden, once something happened and my back just went,
Yeah.
and I was like, what the hell is that? And it wasn't anything in particular.
Mm-hmm.
But I think it was the combinations of things. I was tired,
Mm-hmm.
right? Maybe I was cold, I wasn't warmed up, and it was this kind of shocking thing. I was ready for it because they're hitting me, but it's
Yeah.
still something that happens, right?
Mm-hmm.
And so in that milieu, my back just spasmed up, and I was like, what is going on?
Mm-hmm.
And if I didn't understand all of what we're talking about, I would have been laid out.
Mm-hmm.
Right. So I got home, I'm driving, and it gets, it's worse when you're driving.
Mm-hmm.
You're sitting down, like it's a half hour to get home, and I got home and it was worse. I
Yeah.
was like, crap. But I kind of calmed myself down, did my stuff,
Mm-hmm.
right? Simple movements, right? Saying, okay, I know what's happening. I didn't hurt myself.
Mm-hmm.
I didn't hurt myself. It was just my body going, something happened. Chill out.
Yeah.
And within a couple of days, day and a half, back at it, and I was
Mm-hmm.
fine. Right.
So it was strictly from that place, because it's a great example. Like the only way I always learn so much better when I'm in pain and I can discipline
Right.
myself to get out of
Absolutely.
pain.
Absolutely.
Was it specifically movements that you did to draw yourself
Oh
out
yeah.
of pain?
Right.
Okay.
I did. I didn't have access to anyone. Right. I was like,
Okay.
oh, I don't want to go to my friends. It was like Sunday.
Mm-hmm.
Right. I was into Sunday, and I did use some heat. Heat's
Mm-hmm.
nice. Heat's always nice, right?
Mm-hmm.
But what I did is I took myself through a series of very easy motions. I don't want to say fully pain free because that's not true, right? You
Right.
have to go a little bit into it, back off, a little bit into it, and back off.
Mm-hmm.
And that's what we mean, you and I mean when we say convince our body that it's okay to do a thing. So
Mm-hmm.
I didn't ignore it and like, okay, that screw that. I'm going to go back into my garage and start deadlifting right now. Well,
Sure.
that's silly,
Yeah.
right? But at the same time, I didn't just lie down on the couch and go, okay, I'm going to wait till it's gone.
Right.
Right. So these are the extremes, right? And
Mm-hmm.
it's pretty natural,
Mm-hmm.
right? Now, if I would have, say, fallen, right, or it was that somebody kicked me in the back, right,
Sure.
or something like that was totally obvious,
Yeah.
maybe I would have just kind of relaxed fully.
Mm-hmm.
But I knew that it was a muscular spasm, right?
Mm-hmm.
Probably multifidus muscular spasm, just because my body was like, something's happening here. I want you to stop.
Mm-hmm.
Right. So I acknowledge that, and I'm like, that's probably not it. I didn't fracture anything. I
Mm-hmm.
didn't do anything. So I'm okay in doing some movement.
Mm-hmm.
Right. What is that mantra? The body, and especially nerves, like blood movement and space.
Okay.
Right. Want lots of circulation. Got the blood flow moving. So I was like, okay, I'm gonna walk. I'm gonna try and walk.
Uh-huh.
Right. I'm gonna try and do some simple stretches. Right. The movement.
Mm-hmm.
Right? Blood goes through our space, meaning, okay, if for example, I didn't have that, but say you had some nerve kind of symptoms, right,
Mm-hmm.
going down to your leg. Well, one of the things is you want to be able to. It's not necessarily anything is pinched, right? But maybe
Mm-hmm.
there's a little bit of swelling. Maybe there's a little bit of the nerve feeling like it's right, getting poked on.
Mm-hmm.
So you do some sort of opening glides, right? You do these
Mm-hmm.
types of things. And it's great because sometimes walking does all that kind of stuff, right? Sometimes doing very simple knee to chest and I'm being vague because you sort of
Right.
do what you and I have gone through this. You sort of examine where you are, and so you move in one way, right?
Oh,
It's very hard to describe.
Not that way.
Right.
I got yeah,
Right.
yeah, I get it.
Yeah.
Well, cool. Talk about, let's see, the pain as being a threat. The pain, like we're exploring movement, like I was just saying, you go this way, oh, I know I don't want to go this way, go this other way.
Right.
Can you talk about how the body perceives the movement as a threat, or go articulate? It's nuanced to this conversation.
Right. So one of the things, and I remember you had asked before, like, what's healthy movement? Right. So this is good. So what's healthy and what's unhealthy? What would be perceived as a threat and what wouldn't be from your body? And one of the things I like to think about it is not so much that there's a correct way to move or there's an incorrect way to move. It's all about our particular current capacities. So a healthy movement would be something that, here's one, right? You hear these things like, okay, when you squat, don't let your knee move inwards or outwards, or don't let it cave in. And that's true if you have problems doing that. Right. But a great example is you look at Olympic weightlifters, right? Lifting hundreds of pounds, and you see them at the bottom of the squat and their knee is in, they do, right?
Yeah.
You're like, oh man, that would bust my knee wide open. And it would, but they have worked up to that capacity.
Sure. And
most of them are fine, right? I'm not gonna say all of them are fine, but most of them, they're at least not, in wheelchairs.
Yeah.
And that's because their physical capacity lets them do that, right?
Okay. Yes.
Their physical capacity lets them do that. So for me, the definition of a healthy movement is within your current capacity, that can either maintain or, in this case of getting better, elicit adaptation so that you can do more and more and more, right? An unhealthy movement would be something that is beyond that, right? And we've seen that all the time, right? Someone wants to get into exercise again, the whole weekend warrior thing, and they do it, and then they're just going as hard as they can, right? And the next day they're toast, right? They're like, oh man. But does that mean what they did was unhealthy? Well, it was unhealthy for them, but that same routine or same physical activity that their friend did right next to them, maybe you can even say that they're almost twins. They're the same height, same weight, same strength, and they were fine the next day. So why was that healthy for them, and why was that unhealthy for this other person? It's because they just didn't. I always think of it as kind of a capacity, their attributes. They just couldn't handle it. So that's the nuance there. So with the threat, but pain being a threat response, is our body has a history. Right? You can go woo woo and go, oh, your body mind matrix and all that has a embodied, but it's true. Our bodies have a memory of things that happen. It was very smart, right? And that's why I always like to say that it is a good thing. Your body's trying to protect you. It remembers things, but that's the trouble, right? It can remember good things, and it can remember bad things.
Yeah.
Right. And so, to me, I think that's the way I look at it and try to explain to patients about what does a threat mean. Well, what it means at this point in time, your brain, your nervous system is saying that's not good for whatever reason.
Right.
Either because it has a memory of stuff that happened before, or something right now physically is going, oh, wait. So for me, then my example of when I was teaching outside, maybe it was the temperature, right? Maybe it was just sort of subtle vibrations, or maybe it was even the memory of getting hurt doing this same thing. Because that's happened. We're martial artists. It happens.
Right.
But our body still remembers it. And I'm not going to be able to think. I wish I could have thought my way out of pain. I would love that. I would have been like, no spasm.
Yeah,
it's fine.
Right. Stop it.
Right? Stop it. I would love to be able to do that, and I can't do it.
Yeah. Believe me, if you figure that one out, I'm
Oh
going to have
man.
you on a podcast again.
Oh yeah, I
We'll,
would love that.
we'll go deep into that.
Right.
I have noticed my own experimentation with it, and you talked about it, was around the fear that can build up in the body as a result of that. So
Right.
the back spasm for someone that doesn't have experience with the pain would immediately go, oh no, and start to
Yeah.
worry about it. And their mind
Absolutely.
is now throwing them into this tizzy, and they're a week and a half out and they're still in pain.
Right.
Whereas someone like yourself, where it's like, oh, you've got this experience, years of experience drawn of working with the body, nuanced movement. You go home, you do the self-care thing to begin to get that moving correctly. You don't hold the fear around it, and then day and a half later you're back to
Right.
normal.
Right. So that's a really good one when you talk about that. So I had just taken this past year, right? We were in quarantine, all that stuff. I decided to take this pain specialist certification. It's through Evidence in Motion.
Okay.
So it's a physical therapy group, and it was great. I did 6 months through it. It was awesome. Loved it. And it was all online. It was something I was interested in before, but uh, I didn't go through. I was like, oh, I have to go 4 different times to the physical locations, and I just my schedule didn't allow it. But now they're offering it all online. Well, anyway, they had all this information. It was great. I loved it. One of their the research that the studies that they talked about was about pain response in people that, as in their history, they did sports as kids, team sports. Specifically, I think it was soccer and American football. And this is the part goes to the part of the fear thing you're talking about. When kids play sports, and it just happened, right? They get hit. They're playing football and not necessarily injured, but they roughhouse, right? They're used to it. Their response to the pain and their way of getting out of it and their understanding of it is much better because they've had the experiences of actually, I don't want to say getting hurt, but being rough and doing all these things much better than kids that didn't have any of that. Right. And I remember I was like, yeah, that makes sense. Because I remember patients coming in that had no pain in their lives at all. Right. You've had that. No pain. So now that this thing happened, it was so brand new. Right. And it's normal to fear something that's so out of the blue. And then you have to reassure them, give them this information versus someone that, they've had this before. They've done all this stuff, and then they come in like, yeah, my shoulder hurts, and just I had, for example, on that, like that other extreme, when I was an intern at Tripper Army Hospital over in Hawaii. uh I had this. I was only 24 at the time. Right. I grad school early, did all these things, but I had a patient that was a Navy SEAL, and I think he was only like 19. So I'm just a few years older than this kid.
Wow.
And he comes in and he's just stoic. And you look at his chart, I like, oh, he dislocated his shoulder, right? You do this. And he was, yeah, I'm fine though. Right. But I looked at all the scans, like, man, this guy is just like, he's just saying fine. And he was like, I did all this stuff. But somebody else who didn't have his, experience of, going through all that rough training and just like all the stuff the SEALs have to do. And they would have the same thing. And they would probably just be like, so guarded and fearful. It's all about your experience. It's all about your experience.
Sure. Yeah. Martial arts.
Right. That's another thing too. I'm used to getting hit, used to doing all these things. So it was not a big deal for me. Now I'm not, and again, let's go back to saying we're not saying ignore the pain. We're not saying ignore it. It's not real. It's not whatever. We're saying that your experience of having it and dealing with it changes how you can get yourself out of it. That's what we're saying.
Yeah. This is great. It want to wrap this up here in a little bit. Is there
Yeah.
anything that we talked about, like a thread that isn't connected, a dot that isn't connected in what we talked about, that it's like you would have liked to have finished up in what we talked about today?
I think we went through the most important parts, and I think that's what it is. Especially for me, and learning more in pain science, especially over the last 15 years, is I see too much of the extreme. I see too much people taking what's real good information, like for example, your meniscus surgery versus sham surgery, where they just did a little thing and just running with it and going, look, it doesn't matter. It doesn't matter that you have this injury or this. You're fine. Just deal with it. Right?
Yeah.
That extreme is just ridiculous. And you know who it's from? It's from people that don't work with clients and patients.
Yeah.
It is, right?
Yeah.
If you are working really with the people around you, trying to help them, and you have that attitude, you're not going to last long.
Yeah.
Who's going to come to you?
Yeah.
Right? And it's the same thing the other way, where I'm just a big fan of saying, stay away from the extremes. Because then you have, and this is another unfortunate thing that's very common. You have someone going to a doctor, orthopedist, that's gonna go, well, we're gonna have to cut you open. That's just the way it is. Look at this MRI. We're
Yeah.
gonna go in and fix you, right? So those are the two extremes that I really want to caution against,
Yeah.
right?
Yeah.
And it's really easy to rail against the health care industry, right? Look at this person, they want you to get surgery. Look at this, they want you to be on drugs. Yeah, but the other extreme is the people saying you don't have to do anything at all. Think your way
Yeah.
through it, right? Pain, your pain's in your head.
Yeah.
So who is the devil? Who is the devil that you want to be within that? I say none of them.
Yeah. I think the essentially the person is empowered with the choice of educating themselves and working in conjunction with people that empower them. I think that's
It's
the big
huge.
piece.
It's
Yeah.
massive. And that's why, when I was looking through what you offer and your site, I'm like, yeah, he gets it. This is what he's saying. We're trying to help people, I don't say figure it out for themselves, but understand themselves and understand what's happening, and being very real about it,
Yeah.
right? Being very real in a way that unfortunately, uh, they've been disappointed by other
Yeah.
healthcare providers, or the information out there, and it's just what you said earlier, you don't know what you don't know. So hopefully we can help as many people as we can to get a little bit more information, and this feeling of empowerment, for sure.
Jarlo, you for the bonus, for the
Oh yeah.
bonus of this, you gave away. I was blown away by what you offered. It's like an 80-page gone. I didn't even get a chance to get through the entire thing. I
Yeah.
got through about a third of it.
So a few years ago, I put together a bunch of material, because people were always, in our company, we always get emails and comments about, on my back is this, my knee is this, and we decided to put together some resources of just kind of explaining. So, for example, the knee, kind of just a really nice overview of, these are ligament, these are the things that could be happening to you, and uh, explaining pain, just like what we did today, and explaining some self-care uh, things that you could do. And so we call it the body maintenance guide, and it has the back and the knee and all these types of things. So again, it's not like, oh, just read this and you'll be fine. What
Sure.
it is giving you a good start, right, and giving you some information as to how I can proceed doing this, and also giving you a little bit of a glimpse of what it means uh, to work on yourself in a way that's healthy, in a way that you don't have to, how do you say it? Don't have to feel that you're this kind of fitness superstar, working out 4 hours a day type of thing. If you can, that's great.
Sure.
Or maybe it's great.
Yeah.
I don't have the time.
Yeah. So this bonus covers the spine, the hips, the shoulders, the knees, the feet, and the ankles.
Yes.
That's what I had made some notes on. So
Yeah.
you can check that out on the bonus link below the video. Or if you're watching the video, this is also going to be on audio as well. Jarlo, do you work with clients individually, or like what is your structure? Is it?
Yeah, I don't do that as much anymore.
Okay.
So in our company, so if you're interested, it's at gmb.io.
Mhm.
And we offer online programs specifically for, we do a lot of full body locomotion work.
Mhm.
Right. So people call them animal movements or, crawling and all of that. That's such a good example. But what it really is, it's just different movement patterns that you can explore.
Mhm.
Right. And it's very good because we take a person from scratch.
Mhm.
Right. And before the whole pandemic, we used to have, lots of in-person workshops, and we have trainers all over the world. And, there's a lot of online stuff where you can do Zooms, and that's great.
Mhm.
But hopefully we can get back to in-person learning as soon as possible.
Sure. So
Yeah.
what I'll do is I'll include the link to your website where in the show notes where they can go to
Thanks.
your website and check that out.
Yeah, thank you.
Maybe either sign up for one of your programs online, or they can connect with one of your trainers, whatever
Yeah,
works for
and we
them.
have lots of other information, articles and our blog and videos on our YouTube channel, all that stuff. I hate saying don't buy our stuff, but you don't have to. You don't have to if you don't want to. But we have lots of people going through our material that just been really grateful to have positive feedback, and they're using it to help themselves feel better and complement whatever they're doing. Whether it's martial arts or other recreational sports, and you know what you like, right? We identify as martial artists. That's our thing. But a lot of times we need things to supplement that, to
Mhm.
make us better at it, but also sort of, if we just did that, maybe we'd be putting ourselves into those own bad patterns, no matter how comprehensive and great we think our particular martial
Right.
art is. There's always some gaps, right?
Right.
Yeah.
So, Jarlo, I want to thank you so much for being on the podcast. It's been
Well,
an
thank you,
absolute
Bill.
pleasure to draw your expertise and share it with other people.
It's great to meet you. I
Yeah.
really like the work you're doing.
Thank you. Thank you very much. Any closing anything?
No, I think that's great. Thanks so much for having me on. Really appreciate it. And yeah, I love talking about this stuff. And it's very important. Even if one person hears this and gets a kind of a light bulb moment and starts working themselves out of their pain pattern, then it's all worth it. It's all worth it.
Absolutely. Okay, Jarlo, I'm going to wrap this up, and then we'll be in touch soon.
Yeah. Thanks so much, Bill.
Okay, so this is Bill Paravano, the Knee Pain Guru. Thanking you so much for being here. Thanking Jarlo for being on the Pain Education Podcast, sponsored by the Camella Foundation. Thank you so much, and we will see you on the next one. To learn more about the work we do at the Camella Foundation, please visit our website at the Camella, COMELLA foundation.org. Join us next week for another conversation on natural healing methods to eliminate pain.